If one or both of your knees are damaged from arthritis or an injury, your doctor may recommend knee replacement surgery. If this is the option you chose, here's an inside look at what happened. Before surgery, you will get anesthesia, so you are asleep during the procedure. You may also get a nerve block around your knees to numb it. When the surgery starts, your knee will be in a bent position. If your surgeon will make 6 to 10 inch long cut in your skin and move your kneecap to one side, the damaged cartilage on your joint is cut away along with some of the bone underneath. The damaged cartilage and bone are replaced with metal parts to make new joint surfaces. These metal pieces are held in place with cement, or they press fit into your bones. The underside of your kneecap may also get a new surface. A plastic spacer is put between the metal parts of your new joint to make a smooth, gliding surface of your joint. Your surgeon will bend and rotate your knee to make sure it works the way it should before closing the cut he made. The whole procedure will take 2 to 3 hours. Afterward, you will stay in a hospital for a few days. You will get pain medications and antibiotics to keep blood clots from happening. You will wear compression boots or socks and work with the physical therapist to move around soon after surgery. For the best recovery, follow your medical team's instructions about diet, wound care and exercise. 6 weeks after your surgery, you will be able to start doing most of your regular activities again. In most cases, knee replacement surgery can lessen pain, fix deformed joints, make it easier to move, and improve your quality of life.